Wimpole Street Dental Clinic. My name is Christian Mill, and in the following small video I would like to show you one of my favorite procedures, the so-called All-on-4 or All-on-6 procedure, which is an operation including the restorative part in the end, where we can give you fixed teeth in one day, of course if we have the correct diagnostic records, which is a life-changing experience, and from my experience and patient experience, a fantastic treatment to restore your confidence and your oral health. So I really hope you enjoy the video, and should you have any questions, please just give us a call.
The All-on-4 treatment concept was primarily developed for the edentulous patient, or, for example, patients running the risk of losing all their teeth, for example, because of a heavy periodontitis. In the first step, together with a dental technician, a setup is made with regard to the new outline, form and shape of the desired teeth. In the second step, this setup is transferred into a radiological or a scan template. After having a three-dimensional X-ray image, a virtual implant planning procedure is performed. During the surgical procedure, this template is used again as a guidance for achieving a very exact positioning of the implants into the jawbone. After the insertion of the implants, a connecting element is fixed onto the implants. These elements can compensate angulations of the implants. In the last step, the prosthesis can be fixed on the implants and screw retained. That was the schematic way. Let's have a look at a clinical case. The X-ray image shows us an edentulous upper jaw, and in the lower jaw we find the rest of the dentition in a desperate condition. The next X-ray image shows the situation after performing the diagnostics and the surgical procedure to insert 4 implants in the upper and the lower jaw. Therefore, the rest dentition in the lower jaw was extracted. The angulated position of the terminal implants in the upper and lower jaw is due to sensitive structures like the sinus in the upper jaw and the big facial nerve in the lower jaw, responsible for sensitivity and motor activity at the corner of the mouth. Therefore, the angulation of the terminal implants is for safety distance. This picture shows the temporary prosthesis inserted immediately after having the surgical procedure. And the patient can use his new teeth immediately after surgery. 3 up to 4 months after having the surgical procedure, the definite prosthesis is performed in the dental lab. Usually, we take a metal framework, and this will be veneered by composite resin or by porcelain. Which kind of veneering material is used depends on the aesthetic demands of the patient. The final X-ray image shows the situation immediately after the insertion of the definite prosthesis. The intraoral situation looks nice with healthy and sound soft tissue, so the patient gets his smile back. Thank you very much.